By the end of this episode, you will have a clearer understanding of how to navigate the healthcare system more effectively and make informed decisions about your well-being. Many Australians are advised to make lifestyle changes to improve their health, but often struggle with knowing where to start in finding the right practitioners to support these changes. And perhaps you've been in this situation, unsure of how to proceed, or having seen a practitioner that perhaps wasn't quite the right fit. This challenge is all too common, and it's exactly why platforms like Health Hunter are so crucial. Welcome to the Wellness Nurse podcast, where we inspire and educate Australian adults on how to live healthier lives for longer. I'm your host, Ros Lindsay, and today we are joined by Brianna Vidal and Sarah Mullins, the co-founders of Health Hunter, a platform dedicated to connecting people with specialised practitioners in lifestyle, integrative and functional medicine. They are going to simplify the process of finding the right practitioner for you, making it easier to take control of your health and find the support you need for vibrant and healthy life. So a very big welcome to Brianna Vidal and Sarah Mullins. Thank you so much for joining us here on the Wellness Nurse podcast.
Yes, thanks, Ros. It's great to be here on this fabulous podcast.
Well, I'm really looking forward to hearing your story. And firstly, tell us what inspired you to focus on preventive and chronic health issues, and how does Health Hunter support Australians in making lifestyle changes?
Yeah, it's always good to start at the beginning, the why. And I think we have come to Health Hunter from a few different areas of our own journey and our professional experience, and then observation of the healthcare landscape as it has been to this point. And Health Hunter was really born out of a mission to make it easier for people or patients to connect with preventative health options. So whether that be a practitioner, a health technology app, or a service, or some research and information, we sort of came at it very initially from the fact that it's really hard for people to access and find this information and be quite proactive and preventative with their health. And whilst there are amazing resources out there, often it's quite fragmented for the end user. So our very first starting point was observing that there wasn't a great experience for that end user when they went to find a practitioner or service based on their own health journey. So for example, somebody has a chronic condition or perhaps early symptoms and signs of a chronic condition. Their journey is often to Google, and they're kind of met with a very fragmented landscape of individual practitioners' websites that they have to go in and out of and try and find what areas they specialize in. And it's not really in one place. So we had that experience from personal experience, family and friends that had their own chronic conditions, trying to find the right people to see and talking about that. And then the other side was our professional experience and background. So Sarah and I have worked in healthcare consulting for most of our careers and on multiple levels. So from working with practitioners and practices right up to bigger healthcare corporates and not-for-profit organisations. And a lot of our work has been on patient pathways or developing better pathways for practitioners to connect with the right patients. So that's really something we have been doing for years in lots of fashions. And most of our work was centered around the system, which is when people are already sick. And for years, Sarah and I talked about the fact that there's not a lot being done on the preventative side for people, you know, perhaps not sick, and also want to make sure that they stay healthy. And through that conversation, we really did deep dive and worked out that there wasn't a great central platform in existence. And that's where the seed of Health Hunter began. And then from there, we very much developed out our vision and strategy for the platform. And then it was developed and launched in early 2024.
Okay, so it's quite new, just a bit over a year old.
First birthday recently.
Congratulations. And so much happens in that time, in the building of it. I imagine, it's been flat out for you both.
And
And
it's been great getting out to market, and then having that wonderful immediate feedback and impact from both sides, our patients and our people and our practitioners and health services as well.
I think that's excellent and congratulations. It's wonderful that you have that experience with chronic care. I'm sorry you've also had the personal experience, but working professionally in chronic care, as I have done as well, we see the real need and we see this burgeoning health system that is struggling under the weight of the demands that are placed on it. And we have to go upstream and see what we can do to prevent or reduce the numbers of people actually coming into the health system in the first place. And that's the space that you've stepped into. How does Health Hunter help Australians take control at this point in a preventive space to make informed decisions about their well-being before they get sick?
Yeah, very good question. So really at Health Hunter, what we've built is this ecosystem, right, as the platform, and very much catering to the chronic and the preventative, those two kind of cohorts of people. Because as you say, 1 in 2 Australians do have a chronic condition, yet they do believe up to 80% of those could be prevented if they were addressed earlier. And it's 1 in 2 females over the age of 15. So with a chronic condition as well, which is very alarming. But so on our platform, how we cater to them is so someone can come on the platform and search by their particular health concern and be matched with practitioners who have a special interest in that area. That's either face-to-face or telehealth. And then it's not just practitioners. We have an array of resources, apps, and health tech and services, all related to those specific conditions, which really help people to educate and manage and track symptoms around these conditions. Really, because it's a whole, as we know, people are trying to get to the root cause of their health concerns, and really it's that holistic whole person health. And recently we've just launched our Health Hunter Wellbeing Check-in tool, where it's really simple and it provides great insights and longitudinal data that an individual can answer short questions around their sleep, nutrition, and really track these trends to see across these categories. And they can share this with their health professional as well, really providing such valuable information there.
I think that sounds like an amazing tool. You also highlighted that telehealth practitioners are on your platform. And I think, having just travelled down to South Australia last week, I sort of escaped the cyclone here in Brisbane. Flying over Australia, I am just reminded again of how vast our nation is and how many pockets of communities there are living in these isolated locations. They don't have access to the health practitioners that we do have in the capital cities. People living in these communities are equally in need of and deserving of assistance from the right practitioners. And so I love that telehealth, we learned during COVID, is such a viable, useful tool, and people from all over our beautiful country can access the care and support that they need. Myself, as a registered nurse, I offer consultations one-on-one to anybody across Australia, and we can just have an online video call. So if that's something you as a listener are interested in, please reach out to me, and you can book on my website at roslindsay.com.
I think one of our missions with Health Hunter as a platform as well is to make it equitable access to healthcare and to preventative healthcare models for all parts of our population. So we're firmly in the health tech space, which is a very exciting time. There's a lot of digitisation of our healthcare models happening right now. But so far on a lot of the preventative and health optimization side, it's sort of formed into more of a high-cost subscription type offering for a certain portion of the population. And that's really not where we want to be. We, as Sarah said, we see ourselves as an ecosystem that helps people connect regardless of where they are, and also gives people that access based on their need. And as you said, there's a huge country here with people in, very diverse populations, and no reason why, just because they may not have an integrative or functional GP in their town, that they can't then access that same provider. So it's a great point, I think, is that as we do move our healthcare models forward, that we still ensure that they are opened up to all parts of our population as well.
Absolutely. Health equity is just so critical. I love hearing stories of people who are facilitating that.
It's a year in. It's amazing actually seeing that in practice now, where we're seeing people coming through from really different areas and remote areas and finding these people through our platform because they have been able to connect with someone that has special interest in their condition. And it's a pretty cool thing to see happening, at a macro level.
They're not just coming in to find the practitioner as well. A lot have kind of early symptoms, and they're coming in and finding a resource that may have even been authored by a practitioner on the platform that's really helping inform and educate them about their health at that earlier stage as well, which is to see, as you said earlier, and as our mission is, to be a very upstream platform and try to help stop the huge impact of chronic health.
If we can prevent it altogether, that's fabulous. If we can step in those early stages of diagnosis and prevent the severity or reduce the severity of it, fabulous. So let's talk about some of the chronic conditions that can be prevented or managed through early intervention. And how does Health Hunter facilitate this?
And I think the stats are stark and they definitely speak for themselves. So what we know in Australia is that 1 in 2 people will experience a chronic health condition at some point in their lifetime if they haven't already experienced that. That's huge, 50% of the population and much higher in certain segments of the population.
Yeah.
It's devastating,
It's unacceptable is what it is. It's just
unacceptable. And the reason we are so tied to the fact that not only is it unacceptable, but it's so solvable, because the stats are that up to 80% of these conditions are preventable. And that is so compelling. 50% might have a condition, but up to 80% are preventable. And you look at those key conditions, they're things like heart disease, diabetes, autoimmune, they're conditions that if we were able to take a bit more of a proactive step in the earlier stages, then we can get on top of them, as you said earlier on. Gut health is a big one, and there's obviously so much research and learning that's coming out about some of these conditions, which is fabulous. So we're getting more information. Our practitioners are more informed, as are people themselves.
Yes.
But there's probably some key conditions that, we know that so much can be done at an earlier stage. And a lot of that does come down to optimizing people's lifestyle holistically or overall. It may end up as a heart condition, but if we go right back down, as we said, upstream, and look at exercise and sleep and diet and all of those key pillars of somebody's health, I think that's the step that often is missed, and then it ends up in this full-blown chronic disease state, which is very traumatic for anyone and anyone's loved ones that experiences that as well. Whereas that sort of upstream approach is going back to the simple pillars of our health and making sure that they are really optimized and addressed early on.
It really is. And I think you just said it. It is simple, but it's not easy. And sometimes I feel that, and I love GPs obviously, but sometimes I feel that people are sent away with a quick statement of, well, you need to eat better or you need to exercise more. And some people just really don't know where to begin. They haven't found an exercise that they love. And in my mind, that's absolutely key. And the most essential thing of all, just to find a way of moving your body that you enjoy, because then it becomes just like a game or something that you do socially. It's actually, you forget that it's exercise and it's really, great for you in so many ways, but you're just having fun. So
and I
that
think
would be
the
key.
role that you would play, Roz, in your own practice, but also where health coaches come in, it's such a fantastic role that they do fulfill for people, because as you said, we might have a shorter time with a general practitioner, for a specialist, for an allied practitioner, but then there's an ongoing interaction potentially with a health coach or even a technology tool that can help us kind of manage the day-to-day steps to well-being. And I think that's where people like coaches help people with that. Find the thing that you love doing and find the way that you can support your nutrition without having to just completely do everything differently and make it hard. You're so right about making things easy and part of people's daily routine is the key to sticking with things. So that's a really important aspect of health.
I think also what you said, they don't know what they don't know, right? They might get told to eat better. Right. What does that really, really mean?
Yes.
Some of the practitioners that are on our platform have excellent gut health programs as well. And that really clearly stating out how they should be eating. And what we have had feedback around and time again is, gut health, as you know, is the precursor to a lot of other conditions as well. And it's such an important aspect to get right, but there's still that level of education needed around that in an ongoing as well.
So I'm imagining myself as a patient going to the GP. They send me on my way. Maybe I've got a few kilos to lose. Maybe I live a very sedentary life or have a few too many wines in the evening. And I think, yep, I'm going to do it. I'm going to change my life, But then I get home and I don't actually know where to turn. I do start Googling, as you say. So how does Health Hunter support those individuals in finding the right health practitioner for their needs, especially if they want to, integrate lifestyle changes?
Absolutely. We're the only platform that is doing this and showing practitioners on our platform with their particular interest, their special interest areas. So if, like you've come on Google, you might be searching for a practitioner and certain health concerns and end up on Health Hunter, and there you can see very, very clearly practitioners near you that have your particular health concerns as their special interest area.
Amazing.
Health again.
Yeah.
And we are matching practitioners to people in this way, in this very personalized medicine kind of way. So that's how they can find the right practitioner there. And then, as you say, and the right tools and resources all around that as well on the platform. So it's all there in the one space for people to be. And it's very customized as well in that way. Not just a blanket practitioner that they might not know. And all the practitioners on our platform have done extra accreditation at some of the major associations in this space around, lifestyle, functional, integrative medicine.
I see.
Really incorporating those principles into the way that they approach and to treat the patients.
Yeah. That's excellent. So I could have a specific concern, such as weight loss, for example, and go to healthhunter.au and just find the section on that and come up with some resources that are going to help me with some practitioners that specialize in that concern and take it from there.
Yeah.
And we have over 100 chronic condition hub pages, which bring together not only the practitioners, but also the content, relevant research and apps and services related to that condition as well. So with the view of being holistic about your health, it's not just one person, it's a team often. And you may often, if you're starting from the very beginning, it might be a general practitioner that you start with. It might be an integrative or a functional or lifestyle GP whose mission is to kind of look at you as a whole and get to the root cause of weight is a good example. It might be weight that's your starting point, but the root cause might be some other things that are happening. Going right down to root cause, which I think from a healthcare point of view, unfortunately, we've moved so far away from that in a lot of traditional healthcare settings where we're kind of looking back upstream and down to what the root causes are with that kind of view to getting people really so much healthier and optimized for their life.
I couldn't agree more. And my own personal journey was I was overweight, but the root cause was sleep apnea. And so I wasn't sleeping. I was exhausted. I ate rubbish food. I had too many glasses of wine at night. I had too much caffeine in the morning to sort of get me going because I was exhausted and couldn't concentrate. It's just this vicious cycle. But sort of addressing that root cause and getting a few of those kilos off to begin with was just the start of a journey of wellness really for me. And as I've gone along, those health goals have changed significantly to now strength and stability and balance. But just finding that right place to start that's going to make the biggest impact for you, and that you are, the area of your lifestyle that you're ready to change as well. Those two things, the biggest impact and the area that you are ready to change, can be the catalyst for a lifelong journey of moving towards wellness. And I'll just mention here at this point that I'm really excited to be launching a course very shortly on taking you step by step through that process of identifying the area that will make the biggest impact for you and that you're ready to change, and putting a plan together that is customized for you, that's going to give you the foundation to move forward step by step, not in a quick fix way at all, but in a sustainable way that will see you change your lifestyle for the long term and experience the longevity, the healthier lifestyle and the longevity that you're after. So we're really excited to be launching that very shortly. Yes. I can't wait. I am so excited about supporting people making changes, because I know it's possible. People go through these cycles of quick fixes and making changes and then dropping back into the lifestyle that they're trying to change, and it hasn't stuck. So that's my passion, where I can help people. And yeah, I'm really excited to be stepping into that.
What we see also is that the check-in tool that we have developed, across these areas, 13 quick questions, is kind of providing exactly what you're saying, and health practitioners like yourself are using this tool as well to help identify with their people or patients, and look back and see surprising results around that, kind of as you said. So sleep was, one of the first issues, and the feedback we get time and time again is exactly that. It's so surprising when you do track it in a longitudinal way to see, oh, that's right, I have been getting bad sleep again and again. And then same thing kind of with mood, mental health and gut health, and the link between those. Really excellent to be able to kind of share those results with a practitioner and then develop this plan on from there.
Absolutely. And I think it's really empowering for people to track their progress, to have that baseline, because as you improve your health, you almost forget what it was like. Like I spoke to somebody the other day and they said, I'm just exhausted all the time. And I thought, oh yeah, I'm not exhausted all the time now. I used to be.
Yeah.
But I'm not anymore. But I'd sort of forgotten what that felt like and how debilitating it is. And so I think tools like you're mentioning give you that baseline. You can move forward. You can monitor your progress. I think it's so empowering. So well done. In terms of health practitioners, like if you are a health practitioner looking to connect with those people, because there's health practitioners out there who are specializing in all these things to help people, but they can't find you necessarily. They want to connect with you if you are experiencing these problems. What do you offer for health practitioners looking to connect with patients seeking preventive care?
Health Hunter is, as we call it, an ecosystem. So it's a brilliant portal for practitioners to not just promote what they do, but really articulate in a deeper way to a potential patient or client what areas of interest they might have and their own credentials, resources within their area of interest. So, for example, if you're a menopause expert practitioner, we have a brilliant one, many brilliant practitioners that have menopause as a special interest area.
Wonderful.
And they have developed courses or resources, like yourself, Roz, and that, is something that Health Hunter is able to help promote. So for our practitioners, it's not just finding patients, finding them and booking appointments. That's a big part of what we offer for practitioners, but it's also a place for them to really enhance their own areas of expertise. So that's building their own profile within their community of other practitioners as well. So what we've found since launching our intention was make it really easy and the pathway really simple for the end user, that being the person or the patient. And what we've found very fast is that we have a lot of practitioners using Health Hunter to find each other, including those in health departments and in government health districts. We've had nurses contacting us saying, I'm using Health Hunter in my local health district to help find preventative and chronic specialists for my patients that are coming through our emergency system, and that's been a fantastic learning for us, because what's that doing? That's trying to give the nurses in hospitals tools to keep people from getting to emergency and connecting them with really great practitioners that can help them be more proactive, be more preventative, and try and get to the bottom of some of these root causes for these very chronic, debilitating conditions. No one wants people to be ending up in emergency departments with chronic conditions. These are things that are hard to solve. They're not necessarily an emergency that's an acute issue. So we all have that shared mission, I think, from our platform and from healthcare providers to get people earlier. So I think from a practitioner point of view, we have this amazing community developing out, and we're finding more and more practitioners are utilising it to find each other, which is a really amazing outcome in and of itself, because you might be an integrative GP and you're looking for some allied health practitioners in your area. We have more and more specialists coming into the platform who are maybe practicing also in more preventative ways and have that interest area as well. We have health coaches, dietitians, such a range of modalities. And again, that is so aligned with the mission, because it's, what is it? It's the sum of the parts. We know that it's not one practitioner often that a person needs. They may need this great team behind them. And so it's great for the patients to be able to find that team, and it's great for the practitioners to be able to find that team.
And it's bringing together all these people that they're so passionate in this area as well around preventative and chronic, and it's great to see.
That's incredibly exciting. The practitioners in the emergency areas of our hospital that are looking for ways to help our patients stay well, to stay out of the system. I think that's just so commendable. And there's just such room there for growth in that area of education, I see, to nursing and medical staff within the healthcare system.
We have lots of other products and plans in place on the education side too, because, that's a natural evolution, is that an ability for each of these modalities to educate each other within the Health Hunter platform. And so we have some exciting plans on how we might facilitate that for practitioners too.
The preventive healthcare space is enormous. It's so untapped. It's so underfunded at the moment, and it just holds so much potential.
With such huge impact. Every $1 prevention saves $14 in healthcare costs. We see that in the patient inquiries we get, with more people trying to be proactive, preventative with their health, and really excellent to see people wanting to track their health on wearables, health and psychosocial data, and now they can, and that is a really exciting space to be.
Are you able to share any specific examples of people who have benefited from Health Hunter or who are proactively making these changes in their lifestyle?
We've had so much positive feedback about the platform so far from really both sides of the market, practitioners and apps and services, associations, saying it is such an incredible platform and resource, and the only one of its kind in Australia. And then our feedback overwhelmingly from patients as well is they are so grateful to have a place where they can find and be matched and have this personalised medicine in the one spot. In terms of some typical kind of inquiries and feedback we get, we have a lot of women, 35 plus, often searching and wanting help with women's health conditions, could be perimenopause, menopause, other sexual function conditions, and they are not only educated, but they're matched with practitioners and have really, we've heard they've had such improved health outcomes, and just to the point of being better informed around all the different options in the space from these people, practitioners who have this as a really special interest and an area on there. And men as well. So many inquiries now we're getting with men who want to be more proactive with their health over 40, and that is amazing to see as well.
Yeah. Oh, that's fantastic.
Comments like, and it might be a male over 50. So often the females in family units are the ones that make a lot of the medical decisions and the research and the finding. So to see a lot of inquiries from men over 50 that are saying things like, I've heard about an integrative GP and I'm looking for options in my area, or very open-ended inquiries where they might have a condition, but they're starting to utilize these terms like a functional or lifestyle. Or I've been told it would be great to see a physiotherapist that specializes in musculoskeletal issues that I have. I think that's a really good sign that we've got people knowing. They might not know who they're looking for, but they're coming into our platform going, this is the type of practitioner I've read or heard about, and I'm looking at my options. And then on our end, we have some brilliant facilitators that help our patients find those people. So if they, find someone and they can book in, but if they then want some other options or different types of practitioners, our team will really go the extra mile to make sure that person's personalized options are presented back to them and in their area or by telehealth, which is
That's amazing.
Yeah.
So a person could come to Health Hunter not really knowing who they need. Health Hunter will personally help them identify who they need, as well as identify a breadth of practitioners that could be right for them.
Oftentimes people come in really with symptoms. They don't know what condition they have yet. If it is a condition. So to be able to be matched with practitioners based on these kind of symptoms along the way is really great as well.
Yeah. That's so good to know.
And that personal service is important. We have actual people on the end of our inquiries going and calling practices and making sure that that patient is booked in and there's follow-up and there's that opportunity for that patient to say how their experience was. And that's super important to us as a platform. Because I think as an individual, we've all experienced a difficulty often in getting into medical practitioners or practices. It's often a really difficult journey. So our role is almost like a concierge service for people, making sure they do find the right person. Where that's a big goal.
Yeah.
And we have a
that's
rating
terrific
as well, an internal platform rating system. Oftentimes it is kind of word of mouth. People, why you might have heard of some great practitioner, and so now we have this kind of end-to-end feedback, because that's really important to hear that patients can rate their experience with practitioners, which is, another kind of mechanism as well.
Yeah. Oh, it's so good. It does take a little bit of time to find the right practitioner, the best fit for you, but this is actually condensing that information and making it so much more accessible.
Yeah. And until now, really there was no one place where everyone was there. And you're right, we've heard amazing stories of some patients have had ongoing gut issues for 8 years or more, really struggling, being, spent over $6,000 trying to get to the root cause of their concerns. And I just heard feedback the other day from this one patient who's seen an amazing practitioner on our platform, and finally through this great functional testing and really huge workup has kind of got to the root cause of it. And now 3 months later is the change in their life, daily life. I think they were having real issue just getting to work because it's so debilitating, and now they can literally get to work fine, and it's made such a huge impact on their daily life. And that's what we are really seeing every day.
Oh, it's so wonderful. And I think it's that investment of money into healthcare is like, well, what is the investment? But if that is a shortcut through to success in that area, or it's sort of weighing up the cost of getting that specific practitioner and the support that they can give you at that time, weighed up against, well, if I don't do anything, what's the long-term cost going to be? As a platform focused on preventive health, what advice do you have for Australians looking to make sustainable lifestyle changes for better health and longevity?
Prioritising one's health is key. So, as you said earlier, finding that starting point is the first starting point. You have to start somewhere. And that's where Health Hunter offers that ability for someone to come on and search for a practitioner or start reading some resources and finding some great tech and apps to potentially measure and manage their existing condition or concern. I think there's that great saying, you can't manage what you don't measure. So tools like our preventative health check-in tool offer a really low touch, free, easy starting point for you to start measuring your own health. And with that data, that you have, it's yours. You have this individual dashboard across all areas of your health. You can do those quick check-ins. You can start to see, okay, this area might be a big issue for me and it doesn't seem to be going away. And so, I do need to get that extra level of help with a dedicated practitioner or service. So I think where we like anything, it's taking the first step sometimes, and it's not always easy to do, particularly once people do get into a more acute or chronic state, it then becomes very debilitating. So our main kids take that step before it gets to that point. And even if you're very well and healthy, I think that's another great area where how do you stay well and healthy? I think there's always another goal that we can achieve with health. It might be fitness related or strength that as you said earlier. So, working out what is those health goals that you have and starting to kind of make steps towards those.
Terrific. So parting words or call to action, what would you like to share with our audience interested in taking those first steps?
Yeah, definitely. We have a little motto that we really like, which is listen to your body when it whispers, otherwise you'll have to hear it scream. So it seriously rings true. You might have all the wealth in the world, but once you lose your health, people often say then once you lose your health, you have nothing suddenly, because that's your day-to-day, that's your family, that's your friends, that's everything. So, don't wait until it's too late. Now really is the time. Here's Health Hunter. Please come and visit it, whether you do have a chronic concern or you should be more proactive, preventative with your health. We have this whole ecosystem here waiting for you, and it's really crucial. It's time is now. We have the tech to track things, and people are wanting to be more proactive with their health. They can see the big burgeoning issue that's coming, with the aging population. So, time is now to take action.
Love that, Sarah. And if you're listening, listen to the whispers of your body before it becomes a scream. That's very powerful. So I will have links to Health Hunter in the show notes. I will have links to Health Hunter on my website, which is roslindsay.com. I would encourage you to explore the resources that Health Hunter has. I would encourage you to come to my website as well. I would love to support you in your journey to wellness and to exploring better health. So thank you both, Brianna and Sarah, for your time this morning and for showing us that the process can be easier to find that right practitioner that we need for our individual concerns. And thank you to tuning into this episode of the Wellness Nurse podcast. I really hope that you found the insights from Brianna and Sarah, the co-founders of Health Hunter, both informative and inspiring. And if you're interested in learning more about how Health Hunter can support your journey, find the link to their website in the show notes. For those looking to take more control over your health, please shoot me a quick email at roslindsay@launchlongevity.com. And get on that wait list. The course, A Comprehensive Guide to Wellness, will help you formulate your customized plan and just get you started in the right direction and to take the right steps at the beginning to get those wins and to empower you to keep going. So thank you again for listening, and remember that prevention is key. As you invest in your health today, you can avoid many of the chronic conditions that affect so many Australians. So I just want to thank Brianna and Sarah again for your time. Congratulations on Health Hunter. It is a unique, innovative platform that will just help so many Australians, and I'm really grateful for your time today. So thank you.
Thanks, Roz.
Yes, thanks, Roz. It's been great to chat.